Hi, I'm Dr. Ste Battaglino with Battaglino Family Chiropractic. I want to talk a little bit about X-ray and why we take X-ray in this office. It's very valuable information that helps us do a good job, and I want to kind of show you what I mean. X-ray shows us a lot of things that we can't feel from an exam. So this area here has gone forward, slipped forward like a slipped disc. It's called spondy or spondylolisthesis. This typically comes from a childhood injury, trauma. So we can also see bone spurs forming in between the bones, which is really important for diagnosing whether it's actually fused and how best to get that area better. We can see curves, but more importantly, we can see specific areas within those curves that need to be adjusted, and we can see the direction they need to be adjusted in. We can see curvatures. We can see also some bone spurring happening because of that curvature over time. This is the neck, so the jaw would be like this, and you're looking this way. This curvature is supposed to look like that. It's breaking down because of this spot right here, and X-ray really shows us what's going on. This is an X-ray from a gentleman who's been to chiropractors for 40 years, he said. He gets the same thing adjusted every time, which I don't doubt. Essentially, they never took any X-rays, and so when we look at this is the left hip and the right hip, and he's looking away. This right hip is shorter. He was born with a short leg. It's a congenital variant, and it's 10 millimeters shorter on this side than this. So this base here is going to be tilted. The body is compensating for it here. So without addressing this, these curves and none of the curves above, because there's going to be curves above too, will be able to be fixed until we address what's going on down here. So basically we gave him a little heel lift to wear under his shoe, like a 7 millimeter heel lift. And it cleared this up, and it cleared this up too. It was much easier than, all these adjustments and years of treatment that he's had. So it really helps with speeding the process up. We can see discs on X-ray. We don't actually see the disc. We see the disc space. In other words, where the disc lives. So this is where the disc lives here. And this is the hole. So the disc is like a shock absorber, but it spreads the bones apart and separates them to create these holes back here. The hole is where the nerve comes out of the spine. So these are looking good here and here. When we get down here, this disc is looking real thin, and this one is looking real thin. And the hole is looking much smaller too. So we can see that this is a chronic disc injury. It's probably from something, 20 years or so prior to the patient coming in. And there's also some repetitive stress there. So it's really important to treat this in a specific way, because discs, he's got sciatica. Sciatica meaning he's got pain and numbness going down the legs. Well, it's because these nerves that provide juice or nerve flow to the legs are being compressed by the disc. So we take pressure off those discs or off the nerves by realigning the spine properly, and the sciatica goes away. We can also see scoliosis. Scoliosis, sometimes they straighten out and sometimes they don't. It depends on what kind they are, how old the patient is, how long it's been there, and so forth. We can also make measurements and really see more clearly what's going on with the scoliosis, where exactly to adjust it, and so forth. So there's a lot of information that helps us do a better job, meaning we can get results more quickly, more affordably, by being more specific and adjusting and correcting it right where it needs to be corrected. Radiation dosage for X-ray, you do get some radiation, but they rate the whole body dose when you get X-rays like this as equivalent to a sunburn. So it's basically dissipated from the body within 3 weeks or so, the effect of it is. So the exposure is totally worth the information that we're able to get, because we're able to do such a better job with it.